Welcome everyone, and thank you for joining us for continuous learning with Bioguard. It is my pleasure to introduce our webinar speaker, Dr. Hung-Shi Chiou. Dr. Chiou earned his master's degree in veterinary pathology from National Taiwan University and is a board-certificate veterinary pathologist in Taiwan. He brings extensive expertise in diagnostic pathology, surgical pathology, and laboratory animal pathology. Currently, Dr. Chiou serves as a pathology specialist at Bioguard. Pathology plays a crucial role in diagnosing tumor diseases, with histopathologic tumor grading offering valuable insights into the expected biological behavior of tumors. In this webinar, Dr. Chiou will discuss the significance of pathology in tumor disease diagnosis, how pathologists assess the nature of masses and tumors, and the critical information that tumor pathological diagnosis can provide in clinical practice. Without further ado, please join me in welcoming Dr. Chiou.
Thank you, Dr. Low. Can you hear my voice? Hello, everyone. I'm Chiou, and the topic of today's webinar is the role of pathology in tumor diseases. I will introduce the role of pathology in the dogs and cats, and let me turn off my monitor first. That the monitor will block the screen. Okay. I'll introduce the role of pathology in dogs and cats tumor disease. That we know that pathology is the golden standard of diagnosing diseases, including tumors. So it is very important to know what information that pathology can provide in tumor diseases and guide the clinicians to make decisions on further diagnostic tests or treatment that are applicable. So this webinar is held by Bioguard Corporation. Bioguard is a company located in Taiwan and provides accurate diagnostic tests in many diseases. So if you are interested, please follow Bioguard on Facebook or LinkedIn for more information. I forgot to mention that I got cold recently, so I might cough openly during the presentation. So if I do that, please forgive me. Okay, this is the disclaimer that this webinar is made by the reporter according to the pathology specialty. The report only contains pathological professional content in pathology and can't respond to any question about other clinical issues or therapy. So if you have any comment or question, please leave your message in the chat box. So here I want to show you is that these are clinical pictures of the skin nodules or masses with different color or appearance. We can see that this one with alopecia and a smooth surface, or this one has red erosion of the mass, and all four of these are alopecia nodule-like lesions present on the different location of the skins. These are all skin tumors. So you can see that these are the diagnosis of the nodules and masses. Like this one is sebaceous gland adenoma. This one is histiocytoma, and this one is also histiocytoma. And this one is plasmacytoma, mast cell tumor. Although the diagnoses are different, they may share similar gross appearances. So another point is that description of anatomical location is quite important. It is very important to clearly describe the location of the lesion before you send the specimen for pathologic examinations. Like if the mass is present on the face or the head or the body or the forelimbs, hind limbs, or tail. And these are the anatomical location of the body, like cranial, caudal, or dorsal, or ventral. So describe the location as possible as you can. And this picture is the skin structures that we can see. There's epidermis, dermis, and hypodermis. Different portion of the skin might develop different skin tumors. So it's very important to describe whether the lesion is located in epidermis, dermis, or hypodermis. And this is the picture of a mammary gland and its draining lymph nodes. And mammary gland tumor is called MGT. MGT is very commonly seen in clinical cases in dogs and cats. When doing physical examinations, regional lymph nodes like axillary lymph nodes or superficial inguinal lymph nodes should also be examined as possible as you could. That if the mammary gland have tumor, the tumor cells might metastasize to axillary lymph nodes or superficial inguinal lymph nodes. And this is the picture of an oral anatomy. Like here we can see the nostril or the lip here, or the oral cavity, or the tongue. And here we can see the teeth. So tumor masses or nodules or lesions might appear on the nostril or on the gingiva or on the tongue. So it's quite important to describe whether the lesion is located not on just only oral mass. So that will confuse us. So where is the lesion located? Okay. And here is the picture of the dog liver. We know that the liver has 7 different lobes. So if you take samples from the liver, you should use sonography to locate the lesion and then tell us which lobe do you take samples from. This table is common skin tumors in dogs. It's a little small that here's with the most common one is histiocytoma, and the second one is perianal adenoma. The third one is muscle cell tumor, and the others are listed here. So on this table is common skin tumors in cats. The most common skin tumor is basal cell tumor. The second one is mast cell tumor. The third one is squamous cell carcinoma. And other like soft tissue sarcoma, like fibrosarcoma, we can see. And this is a diagnosis approach to the tumor cases. First, we should know the signalment and clinical signs and what history of this patient. And then you might do some imaging examination of the thoracic or abdominal cavity to see if there's any lesions present. And then if there is a tumor mass, you can take cytology samples to exams, and then if the cytology sample could make sure you make sure that it is a tumor, you may resect the mass, then send it to histopathology examinations. The first is cytology examination. Pathology examination can performed on the mass or lesion on the body surface or in the body cavities. Pathology can guide clinicians to decide what kind of examination or treatment should be performed next. Also can evaluate how much the surgical margin should be excised to the tumor. These pictures are sampling method of cytology sample. When a lesion is present on the body, like skin or subcutaneous, the clinicians might use a syringe connected with a needle or a butterfly to collect the cytology specimens. The clinician usually use sonography to locate the lesions when the lesions are inside the body, like these two pictures. Okay, this is a patient that it's a French bulldog with multiple swollen lymph nodes, and this is his head here, and these are the hands of the clinicians that hold he hold the swollen lymph nodes, and then the other hand use a needle to collect the cytology samples. And then the cytology samples should be collected in the head of the needle here. And this is the same case, the French bulldog that has multiple swollen lymph nodes. Since lymphoma is highly suspected in this patient, the spleen and the liver aspiration was also performed, and the cytologist examination was also done. We can see these clinicians use the sonography to locate the liver and the spleen. We can see here, and then use the syringe connected with the needle to take cytology samples. And we know that is before doing all these tests, we should shave the hair, strip the fur, and disinfect the area. When sampling of internal organs, sonography is an important tool to locate the lesions and guide the needle. That we can see the needle under sonography here. The cytology samples was then transferred to the tissue slide and do the cytology smear, like a blood smear, the way you do blood smear. This is the most common smear methods clinically, that you can see that two slides vertically and then smear the cytology sample. And this is the good slide with well thickness and staining quality of cytology specimen. In the whole slide, we will examine the whole slide of the specimen. In addition to smear method, these pictures are different ways to make cytology samples, depending on the sample status. Here we can see that the clinician pressed the sample directly on the slide. And this one is apply the sample from the cotton swab directly to the tissue slide. So we can see that this is the slide after staining. When sampling and diagnosis of lesions include, like if the lesion is present, we might do the fine needle aspiration to collect cytology samples to further examination, or you can uh, do the biopsy or excision of the lesion or mass, then sending to the histopathological examinations, and the pathology results might include inflammation, hyperplasia, tumor, or other diseases or other lesions. Here we can see that the two different biopsy way. That the first one is needle core or true part biopsy, and the other one is punch biopsy. True part biopsy can also be used in taking samples from internal organs other than superficial masses or nodules. A punch biopsy is commonly used in the mass or nodules present on the skin or subcutaneous. And the surgical excision of the mass or lesion is the most common specimen that we received clinically. And this is the mammary gland tumor case. And here we can see this is the mammary gland specimen. The whole mammary gland was resected by the clinician, and the lymph nodes are also collected, like might be here in the adipose tissue. When the lymph node was not involved by the tumor, it was usually very small and soft and might not be visible or palpable clinically. So it's quite important that the pathologist should have to examine the adipose tissue here. We make slides here all the way from here to the end. Then we can see that there is a lymph node present about like just 1.5 centimeter, then very small, soft, and only like a yellow discoloration. Excuse me. And so it's quite important to examine the lymph node in tumor cases. And this is the trimming method that we receive. We receive the specimen. We usually do the straight vertical section of the specimen is the most common trimming orientation. Then we take this portion to do further histopathology examinations. We take the then we take this section here. We can see the lesion is presented here, that the specimen is too big or large to put into the tissue cassette. So then we take this portion of the specimen to put it into the cassette and then making the slice for us to examine. Here we can see that it is a tumor here, and these are the normal tissue surrounded the tumor here. Okay. These are different tumors in histopathology, like further mentioned before, that we can see sebaceous gland adenoma, like we can see that the tumor cells arranged in different sizes of lobules, and this one is histiocytoma, is one of a round cell tumor, which is arranged in solid sheets, like a plasmacytoma, also a round cell tumor, and melanoma is a very difficult a tumor to diagnose you if it get very aggressive, and Mast tumor and lymphoma. And different tumors might have similar histopathology features, like these all three pictures are soft tissue sarcomas. And the first one is fibrosarcoma. The second one is leiomyosarcoma. And the third one is malignant peripheral nerve sheath tumor. All these soft tissue sarcomas might have similar features, like they are all spindle cells and arranged in their interlacing bundles or streams or whorls. So different tumors might have similar features. And here is another table that histopathological description in the report. Like we can see, we use we see different pattern, like a reticular pattern, rosette, sarcomatoid, storiform, syncytial, trabecular, or nest-like patterns. So if we cannot diagnose tumor based on HE stain slides on histopathology, we should rely on immunohistochemistry. It's also called as IHC. IHC is based on the principle of antigen and antibody binding. When the tumor is difficult to differentiate by histopathology, IHC may help us pathologists to identify the origin of tumor cells. It's used a specific binding between antigen and antibody in the immune reaction, and presenting detectable signals on antibody so as to observe whether the target antigen exists in the sample. Usually we use monoclonal antibody that only recognize a single epitope of the antigen of the tumor cells. So it's more specific, sensitive, simple, and rapid when used in IHC experiments. IHC is commonly used in differentiating lymphoma, whether it's B cell origin, T cell origin, or NK cell origin. And IHC is also commonly used in round cell tumor differentiation, soft tissue sarcoma differentiation, or other sarcomas. And here, this one is the gastric mucosa biopsy pictures. You can see this is the surface of the gastric mucosa. We can see that the lamina propria of the mucosa was dilated by a lot of tumor cells infiltration. Then we can diagnose this case by histopathology as lymphoma, gastric lymphoma. But we don't know whether it's B cell, T cell, or NK cell. So then we do the IHC stain, and here's the CD3, and this one is the CD20. So we can see that CD3 is positive and CD20 is negative. So this case was diagnosed as gastric lymphoma T cell origin. And this one is a specimen from the spleen mass. Here we can see that a lot of brown cells with pleomorphic appearances with variable sizes of nuclei, and then we can diagnose this as spleen lymphoma. And then we do IHC scan, as here we can see that the CD20 here and the CD3 here. So we can see positive signals of CD20 present on the cell membrane of tumor cells, and the CD3 is negative. So we can know that this one is spleen lymphoma, B cell origin. And this one is intestinal mass. We can see that is about 3 centimeter diameter size of mass present on the small intestine. When we do the histopathology, we can see this the tumor cells are spindle cells arranged in interlacing bundles or halls or strings patterns. Then we get the diagnosis as leiomyosarcoma of a small intestine. But we should have to rule out other tumors like GIST. So then we do the IG scan. As we can see here is the smooth muscle actin, and this one is the GIST marker. And the smooth muscle actin was positive, and the marker of GIST is negative. So the case was diagnosed as intestinal leiomyosarcoma. And here is the tumor grade. The meaning of tumor grade is the histological grade of tumor. The tumor histological grade was scored according to the arrangement of tumor cells, cell morphology, mitosis, and other histopathologic features. So only when after histopathological examination we can get the tumor grade. For example, we can see this is the canine mammary gland tumor grading system. The canine MGT can be graded into grade 1, 2, 3 based on the tumor of tubular formation or nuclear polymorphism and mitosis. We can get different points from different columns, and then we calculate all the scores from 3 to 5, 6 to 7, or 8 to 9. We can get grade 1, 2, or 3. And the grade 3 is the most is poorly differentiated and has higher metastatic grade than grade 1 and grade 2. Here we can see that the grading of canine MGT is associated with survival time. That grade 1 and grade 2 MGT had longer survival time than grade 3, which had a short survival time. The horizontal is survival time, and the vertical axis is the survival rate. Here we can see that the grade 3 had the most short survival time than grade 1 and grade 2. Here you can see that lymphatic invasion of canine MGT also had shorter survival time than no lymphatic invasion. Here you can see that horizontal axis is survival time, and the vertical axis is the survival rate. Here you can see that the blue line is the absence of lymphatic invasion had a longer survival time, and the red line is presence of lymphatic invasion, which had a shorter survival time. This is the grading system of canine mast tumor that now commonly used. Is a system called Tumor system that degrades mast tumor as low and high grade based on mitosis, multinucleated germ cells, nuclei, and the periomegaly. The average survival time is 3.6 months of high grade and more than 2 years of low grade. Here we can see the pictures of low-grade muscle tumor and high-grade muscle tumor. The high-grade muscle tumor had a larger peripomorphic nuclei and more mitosis here, and less granules compared to the low-grade muscle cell tumors. This is the grading system of canine soft tissue sarcoma. The soft tissue sarcoma is also graded into 3 grades like American tumor, canine American tumor. It was based on the degree of tumor differentiation and the necrosis and the mitotic index. Here, mitotic index, tumor necrosis. And then we can get different kind of score and then add it up to about a 3 or 4 to 5 or over 6. Then we can grade soft tissue sarcoma into 3 grades like grade 1 to 3. Grade 3 soft tissue sarcoma had higher metastatic rate and the recurrence rate compared to grade 2 and grade 1. And then when speaking of tumor, that we use tumor stage. Tumor stage describes the distribution of tumor disease in the body. Staging is the act of performing diagnostic tests to systemically evaluate the spread of tumor to determine tumor stage, and is typically performed as a baseline prior to initiating treatment or therapy in the patient. Staging can be repeated over time in patients at risk for tumor spread or with non-spread to monitor change from baseline and assess rate of change and determine response to treatment. It was called as TNM system. T means tumor, usually means the size of tumor, and N as a node usually means the lymph nodes, and M means the metastasis. Here's the box, the table of TNM systems. Like many tumor types have unique staging schemes devised by WHO. The TNM system indicates distribution of disease in relation to sites at risk for tumor involvement and reports the status of tumor size or as T1 to T4. And the stage is influenced by increasing tumor size. Specific size designation are incorporated in the staging schemes. Lymph node metastasis is reported as absent, like N0 here, or regional lymph node M1 here, or distant lymph node N2 here. Distant metastasis is reported as absent, like here, M0, or present, M1 here. It's when determining TNM stage, the tumor, the node, and the metastasis should be assessed individually based on the tumor characteristics and the highest applicable stage selected. For example, tumor characterized as stage 2 based on tumor size, but stage 3 based on distant metastasis. So this tumor case should be staged as stage 3, not stage 2, okay? Okay, Here are some tumor cases that I want to show you clinically. The first one is Maltese, a dog, 8 years old, and FSP, which had MGT history. Then we can see that there is some mass or nodules present uh, on the skin of the abdomen, close to the mammary gland, nipple here. And we can see that there's some red discoloration of the surface of the mass, and the texture is firm, and the mass is movable. Then the clinician resect the mass and send to histopathological examination. Here we can see this one, the mass was diagnosed as mammary gland tumor, mammary gland carcinoma. We can see that the tubules here, mammary gland tubules, arranged irregularly in tubules or cluster-like patterns. And this one is a dog, 9-year-old, and the gingival mass here around the canine. And then we can see this. This is the histological result. We can see hyperplasia of the gingival epithelium, and the mucosa was infiltrated by abundant inflammatory cells, mainly composed of lymphocytes and plasma cells, admixed with neutrophils and few macrophages. So this case was diagnosed as chronic gingivitis with gingival hyperplasia. And this one is Maltese, 11-year-old, and we can see this one is the gingival mass here. And here we can see that this one is diagnosed as epilis. We can see that cells arranged here, and then we can also see like bone tissue formation here. So it was diagnosed as epilis, not inflammation. And this one is West Highland White Terrier, 9-year-old. And this picture at the left, you can see that there is a small nodule or mass present on the nose. Pretty small, like 1 centimeter diameter. And after 6 months, it increased in size to about 5 to 6 centimeter diameter. And then the clinician resect the mass, send for histopathological examinations. We can diagnose this tumor as trichoblastoma. It's a benign tumor, not a malignant tumor. This one is a Welsh Corgi, 13 years old. Here we can see that there is a chest mass here, which is soft, movable, but a little bit red discoloration on the surface of the skin. And the mass is close to the mammary gland or to the nipple. So the clinician suspect this as a mammary gland tumor. But we can see that under histopathology, it was diagnosed as lymphoma. It's a benign tumor. And this one is a dog, 16 years old, and there's a mass in the ear canal. We can see that the inflammatory cells infiltrating the dermis of the ear canal. We can see hyperplasia of the epidermis, and then we can see a large area of granulation tissue formation here. So this one is diagnosed as chronic otitis. In this case, is a dog, 12 years old, gastric mass. Here we can see that there's a mass or nodule present in the gut, in the stomach. And here you can see that there, here is the gastric mucosa, and then we can see the mass is located in the muscle layer of the stomach. And then on higher power field, we can see that there are abundant spindle cells arranged in interlacing bundles or strings. And then we do the ultrasound. It was confirmed as cyst. And here is the dog, 17 years old, and he has a gastric mass here. And the clinicians take the biopsy samples to examine. Here we can see that the gastric mucosa here, and then there's abundant inflammatory cells infiltration in the laminar propria of the gastric mucosa. So coronary gastritis was diagnosed based on these specimens, but these specimens are too small to might not be able to present the whole mass here. And here we can see that there's a cat subcutaneous mass on neck. Like, first, the clinician take a biopsy samples, and then we only see the normal muscles. So then we suggest him to resect the whole mass and send for histopathological examinations. Then we can see this is the cat fibrosarcoma. So it's quite important to let the clinicians know that this specimen of biopsy might not be quite good. And this one is the dog, which has a subcutaneous mass on back. First, the clinician collects the cytology samples. We can see that the typical appearance of mast cells. So this mass is diagnosed as mast cell tumor based on cytology examination results. So the clinician decided to resect the whole mass, and then with wide margins. And these two specimens are the margins specimens for us to examine if there is any tumor cells present at the margin. Here we can see that there is a high grade mast cell tumor. Okay, this one is a cat which has a subcutaneous mass on the back. Here we can see that here it is about almost 10 centimeter diameter, and it was unmovable. And here we can see that there's a multiple observation of the skin here. And then we do the histopathological examination. We can see that there's an abundant fungal element surrounded by abundant mixed type inflammatory cells like macrophages, neutrophils, lymphocytes, fibroblasts. So this case was diagnosed as pseudomycetoma. Pseudomycetoma is a disease that's commonly induced by fungal element in cats, usually Microsporidium canis in cats. This case is a cat which had an intestinal mass here. We can see that there's a brown discoloration of the intestine, and the mass is located here and with firm texture. And then we do histopathological examination. we can see that there's a mixed type inflammatory cells infiltration and the pyogranulomatous inflammation here composed of macrophages, lymphocytes, neutrophils, and the fibroblasts. And when we see pyogranulomatous inflammation in cats, there's a disease was highly suspected, which is called feline infections peritonitis, also known as FIP. So then we do the IHC scan. There we can see the positive signals of FIP. So this case was diagnosed as FIP infections. When you see the lesions, like a mass look in the intestine, there's several differential diagnoses that you may make, like a tumor or trauma or foreign body or infections, like FIP. So it's quite important to send to the specimen for further histopathology examinations. So Bioguard has a Q mini PCR machine that can be used for clinical molecular biological detection of specific pathogens and can quickly and accurately detect whether there is a target pathogen in the patient. And this is the FIP test results. Here we can see the amplification curve in the report. So if you have the need for molecular detection you can contact Bioguard for more information. And this one is the case that a French Bulldog that have multiple lymph node increased in sizes. In the cytology and true biopsy, specimens were done by the clinicians. Here you can see this is the cytology picture. We can see there are mounted large round cells here at the basophilic cytoplasm here, and large nuclei with one nucleolus here. So it was diagnosed as malignant lymphoma based on cytology, and biopsy samples were also examined by pathologists. Here we can see that it was also a lymphoma. In addition to the round cells, we can see the mitosis here and apoptosis here. And then we do the IHC scan. This is the CD20 result. We can see the positive signals present on the cell membrane or in the cytoplasm. So it was diagnosed as B-cell lymphoma in this French Bulldog. And this table is stage of lymphoma staging system. The stage 1 is involvement of a single lymph node, and the stage 2 is involvement of multiple lymph nodes in the same region. And the stage 3 is generalized peripheral lymph node adenopathy. And stage 4 is involvement of internal organs like liver or spleen. Then stage 5 is involvement of bone marrow or other organ systems like a central nervous system or eyes. And stage 5 can be divided into substage A or substage B, that without clinical signs or with systemic clinical signs. And here we can see that chemotherapy drugs are usually used in clinical tumor treatment. Chemotherapy drugs not only inhibit tumor growth, but also affect normal tissues or organs. Therefore, it is important to monitor patients' blood index, serum biochemical index, and coagulation function periodically. So Bioguard also has an in-house machine called MiniCan Veterinary Calculation and Chemistry Component Analyzer to analyze calculation and chemistry parameters, not only for tumor patients, but also for non-tumor cases. So if you need calculation and chemistry analyzer, please contact Bioguard for more information. Okay, thank you for your attention. This is at the end of today's webinar. So if you have any questions too, please let me know. Let me check the mail chat box. Okay, I see there are a lot of people ask for the PDF or PowerPoint, so maybe we can send the PDF to those who need. And here you can see, here I see a question that how can we detect if the lymph is affected? I don't know what you mean that if the lymph node is involved by the tumor. If your question is this, so we can do, if you want to check if the lymph node is involved by the tumor, you can use FNA to take cytology samples of lymph node to examine the cytology specimens. Or you can resect the lymph node directly and send for histopathological examinations. And another question is how to make a diagnosis with malignant or benign melanoma based on histopathology. I know there's many articles and articles or books to there's many reference uh, mention this. So I suggest you to search for those reference. Okay, here is another question that asked me to make differential diagnosis based on histology of vagina leiomyoma from vagina polyps, lipoma, fibroma, leiomyosarcoma, DVT, and adenocarcinoma. These all lesions have specific different kind of histopathology features. So it's quite easy for us pathologists to make diagnosis to differentiate these lesions under microscope. Like a myeloma, we usually see will differentiate smooth muscles, smooth muscle cells arranged in strings, and vagina polyps. We usually see the fibrous tissue or hyperplastic separate epidermis or mucosa, and lymphoma. Lymphoma was composed of lymphocytes only. Lymphoma is composed of abundant collagens, and leiomyosarcoma is composed of four differentiated smooth muscle cells. And transmissible venereal tumors known as TVT, which is a round cell tumor. Okay, adenocarcinoma, which is arised from the glands tissue. So it might have different kinds of histopathological features. So it is quite easy for us to diagnose. But it might have similar gross appearance. So it might be difficult to diagnose clinically just based on the gross appearance. Often cases of FISS that you meet, like every day, every month. If we completely see the feline injection size of tissue sarcoma and how long that it will come again, it's hard to say. It's hard to say. In my experience, the recurrence rate is quite high in Taiwan. About 3 months or 6 months or 1 year. You take it. First, there's a question that we take a biopsy first or surgical excision first to decrease risk of malignancy or if it's malignant. In my opinion, I suggest you to take a biopsy first to see if it's a tumor or an inflammation or hyperplasia or others. Once you confirm that the biopsy specimen is a malignant tumor, then I suggest you to do the surgical excision of the mass. There's one person mentioned that he sent the specimen to the pathology lab, but they don't give the tumor grade. So maybe you receive the reports, then you can call back to ask if they can provide the tumor grade. And there's another question that how to differentiate between lymphoma and the mistaken connective tissue collection during cytological diagnostic sampling. So it's quite difficult to differentiate normal adipose tissue between benign lymphoma. So if you see a lot of lymphocytes in the cytology, then you should let the owner know that there are some differential diagnoses like normal adipose tissue or lymphoma or other diseases. So that, and we can give them choice that we can make biopsy or resect the mass directly for histopathology examinations, or just let it be and then we observe a few weeks to see if it's increasing sizes. Yes, here's another interesting question that if the it, uh, if suspected lymphoma cases is the suspicion of one large lymph node sufficient, or is it recommended to submit more than one lymph node samples? I would suggest to send multiple lymph node samples, and then if you see a large lymph nodes, we should take samples from popliteal lymph nodes or axillary lymph nodes or submandibular lymph nodes. But you have to put attention to the submandibular lymph nodes because the dog and cat oral cavity is not quite clean, so the enlarged submandibular lymph node might be reactive hyperplasia or lymphadenitis. So I would suggest to take lymph node samples from distant lymph nodes like popliteal lymph nodes, inguinal lymph nodes, or axillary lymph nodes. Here's another question about treatment of mast cell tumor and fungal infections. I'm sorry, I'm not able to answer this question. Okay, it's if you have any other comment or question, let's end today's webinar. Thank you for attending this webinar.
Thank you, Dr. Chiou, for the outstanding presentation. And thanks to everyone for joining us today. We look forward to seeing you at our next webinar. And good night.